Access Map is an exciting initiative that CTAC has been working on. It's a comprehensive online interactive tool that will be available on our website, and it will map out the current treatment access landscape for HIV and hepatitis C treatments. And what we're hoping for with this map is that it will not only change the ways that people access information about drug availability across the country, but we're also hoping that it will strengthen avenues for access to different treatment care and support services. The map will benefit a variety of people, including policymakers, researchers, and other healthcare professionals, but most importantly, we're hoping that the map will benefit people living with HIV and hepatitis C. Well, out of all the developed countries in the world, Canada is one of the few that doesn't have a national pharmacare strategy. And then if we want to break that down even further and look at the developed countries that have a public health insurance program, it makes Canada the only country that doesn't provide access to prescription drugs. So the situation here is that provincial, territorial, and federal governments operate entirely separate public drug programs. In Canada, we have 19 different public drug programs. And now when we add private insurance to the mix, we have over 1,000 different public and private programs. And roughly 40% of our population relies on public drug coverage to obtain access to necessary medicines. So essentially what we have here is a patchwork system where the type of coverage in terms of the scope and the quality of coverage largely depends on where you live and where you work. Now, if we look at what drugs are covered, the eligibility requirements, the out-of-pocket expenses that a person may have to incur, it will vary significantly from one province or territory to another. And now, if we want to break that down even further and really put it into perspective, if you're a person who's living in British Columbia and has coverage under the HIV drug treatment program, you have 100% free access to antiretroviral therapy compared to another province such as Ontario, where you're paying about a 4% deductible of your total household income to obtain treatment. Now, knowing all of this, CTAC held consultations with our stakeholders that included frontline service providers, including nurses and support workers, other healthcare professionals, and community members. And it was evident that we needed a tool such as the Treatment Access Map to not only equip people with the information, resources, and tools to navigate some of these structural barriers, but to also empower people to act as agents of change. In our initial launch, the Treatment Access Map will include information about what HIV and hepatitis C drugs are covered in your province or territory. And this will include the price of drugs, the formulary list dates, eligibility criteria, and the average cost if you're paying out of pocket, if you're covered under a private insurance plan, and if you're covered under a public insurance plan. We'll also include information about what drugs are covered under the 6 federal drug programs, as well as have information about what to expect, in terms of what drugs are in the pipeline, and we'll also include information about how to obtain access to coverage when moving between jurisdictions. In the future, we'll be adding a lot more information. So we'll be adding information on testing services. We'll be adding information about the specific treatment needs for co-infected individuals and newcomers, as well as treatment access information for mental health and other HIV-related comorbidities. The ultimate goal for the Treatment Access Map is that we won't need a Treatment Access Map or any tool like it, so there won't be a need for it to exist. And what we mean by that is that we're hoping that the tool will be used and it will stimulate a national discussion and response enough so that every person who's living in Canada will have access to equitable and universal coverage. For more information on this and other treatment access issues affecting people living with HIV and hepatitis C, please visit us at ctac.ca.